Hello, my name is Wesley Shaver, and I'm here to talk to you about my passion of becoming a nurse practitioner. You may be wondering, what is a nurse practitioner? What do they do? Nurse practitioners are advanced degree nurses that have undergone postgraduate education obtaining either a master's or doctorate degree. These nurses can diagnose, manage, and treat health conditions independent of or under physician supervision, depending on the state. What I mean by that is in some states, these nurses are able to function without any supervising physician. Here in North Carolina, nurse practitioners are required to have a supervising physician. Still though, these nurses are able to prescribe treatments and medications, and in the hospital, they may be the ones writing the orders and directing the care of patients. Again, as I said, in North Carolina, nurse practitioners function under it's called a collaborative practice agreement. Basically, it describes what treatments and medications these nurses are able to prescribe. I feel called to be a nurse practitioner because I want to be able to take even more control in managing the care of patients. Currently, as a paramedic, I already function independently many times of a physician, and I'm able to make those calls. As an RN, your scope is limited, and it is based off the orders given to you by physicians and nurse practitioners and physician assistants. By becoming a nurse practitioner, I will be able to make those decisions independently, much as I do as a paramedic. I feel in this way I can positively influence a patient's care and have the greatest impact. What does it take to become a nurse practitioner? So, for starters, to become a nurse practitioner, you must have a bachelor's degree in nursing. You must have at least 1 year of experience, which this may vary depending on the school and the program, but most programs at least 1 year of experience as a nurse. Of course, you must be an RN, that is a registered nurse. Depending on the school, you may have to take the GRE. Not every school requires it, and different ones have a different requirement for the score that you have to score. Once the school is completed, the nurse practitioner will be able to take the certification test, and then here in North Carolina, once you take your certification test, you are able to apply for your licensure. Now, the certification test, there's several different ones. It's based on what area, what specialty you want to specialize in. There's adult care, there's acute care, there's pediatric, there's gerontology, there's multiple different ones, and there's different credentialing agencies out there. But it's one of those things that while you're in nurse practitioner school, you just kind of have to get a feel for what area or expertise you would like to specialize in. So here I have a timeline roadmap of my journey to become a nurse practitioner. First, we have January of 2020. This is when I began nursing school at Mitchell Community College. Next on the timeline, I have May 2021, and it is when I will hopefully graduate with an associate's degree in nursing. And then I assume sometime around June 2021 that I'll be able to take the NCLEX, and if I pass it, I will become a registered nurse, licensed in North Carolina. And from there, I would hope to have a job working in a hospital by July 2021, preferably working in emergency care or critical care. I feel these are the areas that I'm most comfortable with and what really intrigues me the most. And then from there, I would take a semester off, and hopefully in January of 2022, I would begin working toward a bachelor's degree. Currently, I want to continue at Western Carolina. I've already done some coursework there. And then in 2 years, by May of 2024, I would hope to graduate with a bachelor's degree in nursing from Western Carolina. And then that would put me applying somewhere after graduation and into August of 2024 to nurse practitioner school. This is assuming that I have met all the educational requirements with my bachelor's degree. Different programs may require different classes, so that will be something as I get closer to applying to nurse practitioner school, I'll make sure that I've met those requirements. And then that would put me beginning nurse practitioner school anywhere between January and August of 2025. And again, nurse practitioner school, because you're working toward at least a master's, that would be another 2 years of school, which would put me graduating in May to December of 2027. And then once I would graduate in 2027, I would be able to take a certification exam. And currently, the area I would want to become a nurse practitioner in is acute care. And then once I have passed the certification exam, then I would be able to apply for my license in North Carolina. So in conclusion, I have told you what a nurse practitioner is, why I would like to become one, what it takes to be a nurse practitioner, and my specific journey on how I can get there. The rest now is up to me and following through with these plans. Hopefully one day I will make it to this goal and be able to direct patient care and make the biggest impact I can in my patients' lives.